Are you planning for every patient that you do? And if so, how has that affected your outcomes?
So we can start on this line and then go down. So for me, I do plan every case. I only get guides. In selected cases, I would say probably 10%, and part of it is delay of manufacturing, part of it is cost. If I had a navigation solution like the one that Matt showed, that today I think is the best solution. Because with a guide or with MR, all you can get is visualize and get the axis pin. Matt can actually rim, rotate, place screws and so on. So I think that's today's the solution. I suspect robot will be beyond that, but because it's so expensive, I think there is opportunity for both. So in a place where there is already robots, people are going to use robots. What do you think, Eric?
Yeah, so I do plan, I don't do patient-specific instrumentation for the most part because of a variety of reasons, but cost is being one of the big inhibitors. I do think that it'll be interesting to see the role for robots. Robots, in some respects, have taken over, like in our hip and knee as well. Most knee arthroplasties now are done by robots. For some surgeons, others not as much. It definitely slows them down a bit. And so it'll be interesting to see the role of the robot in the higher volume shoulder surgeons practice. I really think the value of a lot of this technology is for the lower volume surgeons as well, and that's going to be interesting to see what's going to be the most accessible to these people or to these practices. So if you're at a big center that can buy an expensive robot, potentially there'll be some narrowing that bell curve, but I think the value is for the ones that maybe aren't doing as many, 200 shoulders a year.